day, sir, and to our fellow nursing student from Block 2 and Block 5. I am Hannah Micaela Pacura, together with Abdelin Mantarola, Mary Ann Ochoco, Adrian Lim Orenya, and Daniel Pablo. We will be sharing today the life of Carmencita Abaquin and her greatest contribution to the whole nursing field.
Good day everyone, my name is Abdin Balyasca Monterola. So today we are going to report about Carmencita Abaquin. Carmencita Abaquin said, to nursing may be able to provide the care that our clients need in maintaining their quality of life and being instrumental in birthing them to external life. We as nurses should be able to provide our clients' need in both life and death. Di ba as nurses, duty natin or mission natin na alagaan ang mga pasyente natin through their spiritually or emotionally o pwede sa physically din. And we as nurses will be able to provide care, and it is generally mean that we as nurses need to be strong and be there to our patients through ups and downs. Next slide. So, about the theories of Carmencita M. Abaquin. Carmencita M. Abaquin, she graduated Bachelor of Science in Nursing from the University of the Philippines in 1969. She is a Filipino nurse with a master's degree in nursing obtained from the University of the Philippines College of Nursing in 1975. She is a Doctor of Philosophy at University of the Philippines in 2000 and started as a staff nurse and became the head nurse at Philippine General Hospital. Next slide. Carmencita Abaquin, an expert in medical surgical nursing with a subspecialty in oncologic nursing, which made her known both here and abroad. So, oncologic nursing, which a nurse who cares for a cancer patients. She had served the University of the Philippines College of Nursing as faculty, held the position as secretary of the College of Nursing. Carmencita M. Abaquin, latest appointment as chairman of the Board of Nursing, speaks of her competence and integrity in the field she has chosen. Next slide. So, holistic nursing interventions. Nursing interventions are provided to address the multidimensional problems of cancer patients that can be given in a setting where patients choose to be confined. Holistic nursing interventions focus on the problems of the cancer patients must experience or mga madalas na maranasan ng mga cancer patients. Next slide. Approaches. Carmencita Abaquin's Prepare Me theory amplifies a type of nursing care or holistic nursing approach that deals on how to care for cancer patients, improve the quality of life patients with cancer and other chronic diseases, terminal illnesses.
Okay, next slide, please. Prepare Me, the holistic nursing interventions, are the nursing interventions provided to address the multidimensional problems of cancer patients that can be given in any setting, where patients choose to be confined. This program emphasizes a holistic approach to nursing care. The holistic nursing interventions of Abaquin's Prepare Me theory focuses on the problems that cancer patients often experience. Prepare Me has the following components: the presence, reminisce therapy, prayer, relaxation, breathing, meditation, and values clarification. Next slide. First is we have the present. This refers to being with another person during the times of need. This also includes therapeutic communication, active listening, and touch. An example of this is the story I read on the internet about a Filipino nurse from Saudi Arabia who has a patient with a breast cancer. The patient would always lie on her bed or sit on her bed with oxygen cannula as a constant aid for better breathing. She was always alone and had no one to talk to. The nurse constantly talked to her if she is fine, visiting her and asking how she is. And because of that, the patient was able to be comfortable with the nurse and she would always have this smile on her face whenever the nurse was around. So, yung presence raw natin is parang pagpaparamdam natin sa patient na may nag-care sa kanila. Though it was actually our work, pero kailangan pa rin nating iparamdam sa kanila na we are there for them and we really care for them. Next is reminiscence therapy. It is the recall of past experiences, feelings, and thoughts to facilitate adaptation to present circumstances. And this therapy is to let patients to share their lives before they had their illness. Like asking kung ano yung trabaho niya noon or how's the experience there and kung ano-ano ba yung mga bagay na gusto niya dati. And in this way, the patient might feel comfortable around you. And this concept provides the patients with the sense of fulfillment and comfort as she look back in their lives. And for the prayer, patients often verbalize their unpreparedness, being afraid to die, and the inability to accept the illness and fate, stating that they would often ask God, "Why me? Out of all people, why did you choose me?" And nurses should extend to provide physical comfort and simple measures such as silence, taking time to listen, sharing stories about hope and faith, connecting them to God through prayer, and in this way, it could make them feel that we as nurses are truly care for them. So, relaxation breathing is the techniques to encourage and elicit relaxation for the purpose of decreasing undesirable signs and symptoms such as pain, muscle tension, and anxiety. Another example of relaxation breathing is what I read on story on the internet, where a nurse was able to apply the concept of relaxation from Abaquin's Prepare Me to her patient. Her patient had a chemo treatment that affected her hair growth. The patient's hair was like a bird's nest and it's also very tangled. The nurse and their companion suggested shampooing the patient's hair, but she would always decline. Then the nurse told the patient that it might help her feel better, and surprisingly, the patient agreed. They did the procedure and the patient smiled. And this might have meant that she might have felt relaxation. And yung kahit sa simpleng pagsama lang natin sa mga pasyente na maglakad-lakad sa labas para makalanghap ng fresh air ay nakakatulong din sa kanila para makapag-relax. Ayan. So, meditation encourages an illicit form of relaxation for the purpose of altering the patient's level of awareness by focusing on an image or thought to facilitate inner sights, which help establish connection and relationship with God. It may be done through the use of music and other relaxation techniques. It may vary from patient to patient, but this concept greatly helps cancer patients to lessen anxiety, depression, and pain that they had been suffering from. Meditation also relieves stress, fatigues, and improves the quality of sleep and mood. Values clarification assisting another individual to clarify his own values about health and illness in order to facilitate effective decision-making skills. Through this, the patient develops an open mind that will facilitate acceptance of this state or may help deepen or enhance values. Their process of values clarification helps one to become internally consistent by achieving closer between what we do and what we feel. The concept of value clarification helps the patient to learn more about themselves and develop reasonable goals. And this will allow patients to make positive changes to their lifestyle so that they can live up to their lives. So next reporter, please.
The meta-paradigm and intervention of Prepare Me theory. The person, patient, environment, health, and nursing. Next slide, please. The theory of Carmencita Abaquin did not specifically mention her definitions of major paradigms. However, by understanding her theory, we can deduce some implications of her views. Person or patient. Her theory is specific to patients with advanced stage of cancer. Carmencita Bakin described person as the holistic being with physical, physiological, social, religious, level of independence, and environmental aspects. Patients who are terminally ill or those with incurable diseases, as with cancer, must be approached in multifaceted care to improve their quality of life. Next is environment. Just like all the other paradigms, environment was not defined accurately. Nevertheless, we can assume that environment is an aspect or dimension integrated to the cancer patient. Her quality of life can also be assessed in this aspect, thus, it must be given consideration in the provision of care. Health. The concept of her theory revolves around illness, particularly cancer, and the provision of holistic care to improve quality of life despite their terminal cases. Health is one of the important domains of overall quality of life. Quality of life is defined as a multifaceted construct that encompasses the individual capabilities and abilities of enriching life when it can no longer be prolonged. This includes proper care and maintaining integrity of the body, mind, and spirit despite the limitations brought about by the present condition. The quality of life is seen through the patient's many dimensions. Next is nursing. The goal of nursing care is the improvement of quality of life for advanced stage cancer patients despite their current situation. Nurses must be seen not as mere caregivers but facilitators of peaceful acceptance of condition. Carmencita Abaquin concept of providing holistic nursing care is addressing the multidimensional problems that cancer patients face is summarized in the acronym Prepare Me. Next na po.
Conceptual model. In the holistic intervention, the Prepare Me is composed of six components. These are the presence, readiness therapy, relaxation activities, meditation, and values clarification. In the person's health, there are the terminal there are the terminal ill cancer patients including physical, social, level of independence, environment, psychological, religious, and spiritual. And again, Prepare Me theory provides a framework on non-pharmacology and then surgical approach of care to advanced cases or the cancer patients. Nurses must see not as mere caregivers but facilitators or peaceful acceptance of condition and the last the quality of time the goal of nursing. The goal of nursing is the improvement or quality of life for advanced stage cancer patients despite their current situation.
So that would be all for the Carmencita Abaquin Prepare Me theory. Thank you so much for listening and thank you so much for watching.